This is something that impacts all of us.
I'm not aware of anyone else in the country doing what we're doing at this moment. It's a group of scientists from across the state of Ohio who bring different disciplines together to actually look for innovative strategies to address the opioid crisis.
Scope gave us access to people in everything from pharmacology to statistics, from nursing to behavioral science, and it's been invaluable.
We actually surveyed all the healthcare programs in the state of Ohio and found there was inconsistencies on training. So we actually developed a curriculum, working with faculty members at Ohio State University, developed a curriculum that actually addressed the areas of need, but then we actually did something unique and developed what's called an escape room, where we put different healthcare professionals in a room together and they work as a team to treat a patient. And so instead of escaping from the room, in this case, they save a patient.
It's everything from treatment of an overdose, treatment of opioid use disorder, but also things that address social determinants of health. So like helping a patient navigate a bus schedule or helping a provider use a treatment finder.
Now we are at almost 2,000 students have been trained across Ohio.
We were able to identify the top 10 counties with the OD death problem.
For these drop-off days, we've now collected over 2,500 pounds of drugs. Get them out of the cabinets, get them away from where either kids or someone who has an opioid use disorder issue could stay away from them. Our ultimate goal there was to be able to risk stratify patients into high, medium, or low risk so that if you're having surgery, an elective surgery, you know if you can be treated and your pain managed with an opioid.
Once people start taking opioids, that small fraction of people become addicted to them, and then it really has this ripple effect that affects our entire community. Hopefully, eventually we can come to the point where we can really hone in on who is most at risk.
I want to make sure that we continue to not only push that work forward, but its applications in the marketplace.
Ohioans should care about the work Scope does, I think, because we try to bring the evidence and the research in an understandable way for Ohioans so that we can make informed decisions on how to help people.
There are people trying to understand the relationship between genetics and these misuse. There are people trying to understand how we can prevent misuse by thinking about access to these drugs, how you store drugs. Then there is a component which involves trying to take back the drugs that are already out there.
Attorney General Yost has identified that yes, we as scientists work well with our agencies, but also we have to find that link to community to find out what works in real life.
I hope to see that what the Attorney General learns from these types of initiatives and from the science that we bring to it, that they can make better informed public policy decisions that'll hopefully help improve the health of patients here in Ohio and make lives better for the citizens of Ohio.
We don't really understand addiction very well, and every family is touched in some way by this. I think there are amazing applications just around the corner based on the work that this group has been doing for the last 6 years.